Hello, this is Dr. Cotty, and today we're going to be talking about crisis management. What is a crisis? Is it a mental illness, a diagnosis? Is it time limited? And can it be managed by normal coping mechanisms? So crisis is an acute, time limited, usually lasting no more than 4 to 6 weeks. It's a time-limited event during which a client experiences an emotional response that cannot be managed by normal coping mechanisms. Everyone experiences a crisis at some point in their life. It's a struggle for adaptation when our equilibrium has been thrown off. It's very personal, and so what one person considers a crisis, another person may not consider a crisis. David Kaplan is a Harvard sociology professor who published a paper on crisis theory. The definition, again, is a sudden event in one's life that disturbs homeostasis, during which usual coping mechanisms cannot resolve the problem. A rapid intervention is critical to help the person return to an optimal state of functioning. So let's talk about the characteristics of a crisis. Can it happen from a positive life event? Well, common characteristics include an experience of a sudden event with little or no time to prepare. The perception of the event could feel overwhelming or life-threatening. There may be a loss or decrease in communication with significant others and a sense of displacement with things that are familiar. So it could be an actual loss or a perceived loss. And there are 3 types. So situational or external. These are often unanticipated loss or change experienced in everyday, often unanticipated life events. An internal crisis occurs when achieving new developmental stages, which requires learning additional coping mechanisms. And finally, natural disasters, crimes, or national disasters can cause people in communities to experience large-scale psychological trauma. So let's review risk and protective factors. Risks include an accumulation of unresolved loss. So an individual who experiences several deaths of loved ones in a close time frame would be an example of this. Other risk factors include current stressors, the combination of both mental and physical health issues, excessive fatigue or pain, and the individual's age and developmental stage. Protective factors include an individual's support system, prior experience with stress and a crisis. So somebody who has survived a lot of things and experienced a lot of stress and several crises over a period of time may be more resilient. Also, age and developmental stage can be both a risk factor and a protective factor. So there are 4 phases of a crisis. Phase 1, anxiety escalates from the threat and it activates an increase in defense responses. In phase 2, anxiety continues to escalate as an individual finds their defense responses are failing to alleviate the anxiety. Functioning can become disorganized, and the client is trying to attempt to resolve the anxiety through trial and error, but everything is failing. Phase 3, as these methods fail, anxiety continues to escalate to severe or panic levels. This leads to fight or flight or withdrawal behaviors. The client experiences in phase 4 overwhelming anxiety. This can lead to anguish and apprehension, feelings of powerlessness, being overwhelmed. Maybe the person feels confused, detaches from reality. It can cause depression and also violence against others or self. Patient-centered care in a crisis always focuses on safety first. So the initial job of the nurse is to make sure that the client is not going to hurt themselves or somebody else, that they're not going to commit suicide, that there's going to be no acts of violence or aggression. So safety first. And the initial intervention, the nurse would want to identify the current problem and interventions for resolution to that problem. They want to take an active and directive role and help the client set realistic, attainable goals. And we'll talk more about goal setting. We want to provide a safe environment. So for clients who have suicidal or homicidal thoughts, we would want to initiate hospitalization. And we always want to make sure that their physical needs are also prioritized. So we want to keep them physically safe. We want to use strategies to decrease anxiety. So part of doing that is to develop a therapeutic nurse-client relationship, and we do that by remaining with the client, listening, observing, making eye contact, ask them questions about how they're feeling, and ask questions related to the event. Demonstrate genuineness and caring. Remember, we talked about empathy. Communicate clearly, and if needed, give them clear instructions. Avoid false reassurance, such as everything will be okay, or other non-therapeutic responses. We want to teach relaxation techniques, coping techniques, and we want to have an action plan. So action plans are usually short, like 24 to 72 hours, and they're focusing on the crisis. And again, these are going to be short, manageable goals. And we will talk about SMART goals, what that means. Some of these individuals are going to require medication. And we would administer those as prescribed. Either anti-anxiety or antidepressant medication may be appropriate. And then we want to provide the client education. So we're going to identify and coordinate with support agencies and other resources and plan and provide for follow-up care. So a SMART goal is specific, measurable, attainable, relevant, and time-based. A crisis intervention is a short-term therapy focused on solving the immediate problem. This might be an individual or group approach, but it focuses on the problem or stressor that precipitated the crisis. The goal of the intervention is to help the person in distress to resolve the immediate problem, regain emotional equilibrium, and return to pre-crisis or higher level of functioning. And it focuses on the healthy aspects of that individual's personality. An important step following a crisis is a debriefing. So providers or individuals who are exposed to a crisis may be debriefed using a group approach. That would include focusing on the present and debriefing again 24 to 72 hours after the incident has occurred. These individuals may have several visits over a period of 6 weeks. These numbers are approximate. And what we're trying to do is manage the acute stress to avoid PTSD. So self-care and debriefing is an important part of a crisis situation. An important part in the nursing process is assessment and determining the client's perception of the event. So we might want to ask the client to describe the events that precipitated the crisis and determine when the event occurred. Consider, is their perception realistic or distorted? We want to assess the support system. So who will be helpful for you at this time? I was on an airplane, probably almost 10 years ago now, and I was flying and a woman had what appeared to be a heart attack. And so all the medical personnel, including myself, went to the front of the plane, and it was quite chaotic. But nobody, by the time I had gotten up there, thought to ask this individual, an elderly woman, who she was flying with. So the first thing I did is I, yelled loudly in the plane, is anybody with this person? And her husband was sitting back there frozen. And he came up and he was able to tell us about her medical, her current medical condition prior to the plane ride, her medical history. So the first thing that we want to do is figure out who can be helpful at this time. And we want to assess the person's coping skills. Remember, coping can be adaptive or maladaptive, but what does the client usually do when there is a problem? When we are considering the nursing process with a client who is in crisis, here are some potential nursing diagnoses. So we want to consider the potential risk for self-harm, ineffective coping, anxiety, or social isolation. When we are planning in a crisis intervention with a client, we want to focus on problem solving, so the here and now. We want to remain with the person who is experiencing the high levels of anxiety to establish trust, using active listening, attending to immediate needs, and conveying empathy. We want to help the client plan for the immediate future. And this might include things like help with housing, food, sleep, need for medications, taking care of pets, and the safety of loved ones. During the intervention, we should realize the client's potential for growth, avoid false reassurance, and clarify fact from fantasy. We want to keep the focus on resolving the problem and teach the client. We want to teach the client to learn to ask for help and to link with community resources. Individuals who experience acute stress reactions may be in fight or flight. And things that they may be experiencing during this time include apprehension, unhappiness, decreased appetite, an increased respiratory rate, heart rate, cardiac output, blood pressure, increased metabolism and glucose use, and a depressed immune system. So remember, emotional and mental stress can also have physical implications. Following a crisis, individuals may have a prolonged stress reaction. This could include chronic anxiety, depression, pain, sleep disturbance, weight gain, increased risk of a heart attack or stroke, decreased libido, problems with concentration, poor medical outcomes such as poor diabetes control, hypertension, fatigue, and an increased risk for infection. So in patient-centered care, we want to work on cognitive reframing, redefining the situation to see the positive as well as the negative sides and how to use the situation for one's advantage. We may work with the client on meditation, guided imagery, breathing exercises, progressive muscle relaxation, physical exercise, journal writing, prioritization, biofeedback, mindfulness, assertiveness training, and tap into their already healthy coping mechanisms such as hobbies, music they like, or pets. When we help the patient use the techniques that we discussed on the previous slide, we teach them to be in the present. So they say anxiety is caused by looking forward, and depression is caused by looking backward. And when we're present, it's a very important step to inner peace. So the resolution of a crisis may be a turning point in a person's life. But at minimum, our goal is to help them return to pre-crisis level of functioning. It may even result in a higher level of functioning because they're going to have more resources and an increased problem-solving capacity. So hopefully they will have come out of the crisis with new coping tools.